Welcome to SS2 Office Practice Term 3. Today we study health and safety in the office, the legal and practical measures employers and employees must take to prevent accidents, injuries, and ill health in the workplace. In Nigeria, workplace safety is governed by law, and both employers and employees have clear duties. An unsafe office is a liability, financially, legally, and morally. Understanding health and safety is important for WAEC and for any future career in administration. Occupational health and safety, OHS/OSH, is the set of practices, procedures, and regulations aimed at protecting the physical and mental health of workers in their workplace. Health and safety management involves identifying hazards, anything that could cause harm, assessing risks, the likelihood and severity of harm from each hazard, controlling risks, implementing measures to eliminate or reduce risks, monitoring and reviewing, checking that controls are working. Common hazards in a Nigerian office environment. Physical hazards. 1. Slips, trips and falls, wet floors, loose carpets, trailing electrical cables, cluttered walkways. Control. Warning signs on wet floors, cable management, keep walkways clear. 2. Fire hazard, overloaded electrical circuits, generator fumes, paper storage near heat sources. Control. Fire extinguishers, smoke detectors, fire exits clearly marked, fire drills. 3. Electrical hazards, exposed wires, faulty equipment, water near electrical outlets. Control. Regular inspection of electrical equipment, do not use damaged plugs or cables. 4. Ergonomic hazards, poor posture from sitting too long, repetitive strain injury, RSI, from typing, eye strain from computer screens. Control. Adjustable chairs, monitor at eye level, regular breaks, wrist rest. 5. Poor lighting, eye strain, headaches, accidents. Control. Adequate natural and artificial lighting, avoid glare on computer screens. Psychosocial hazards. 6. Workplace stress, excessive workload, harassment, unclear job roles. Control. Clear job descriptions, fair workload distribution, anti-harassment policies, EAP, Employee Assistance Program. 7. Violence and harassment, verbal abuse, physical intimidation, sexual harassment. Control. Zero tolerance policy, grievance procedures, CCTV, training. Key Nigerian health and safety legislation. 1. Factories ACT, CAPF1, LFN 2004. The principal law governing health, safety, and welfare in factories and workplaces requires registration of factories, inspection, employer duties. 2. Labor ACT, CAPL1, LFN 2004. General Employment Law, employer duties to provide safe working conditions. 3. Employees Compensation ACT, ECA, 2010, requires employers to contribute to the Employee Compensation Fund, managed by NCITF, Nigeria Social Insurance Trust Fund, employees compensated for work-related injury, disability, or death. 4. Petroleum ACT and DPR regulations, specifically for the oil and gas sector, strict HSE, health, safety, and environment requirements. 5. NCITF, Nigeria Social Insurance Trust Fund manages worker compensation, employers contribute 1% of payroll monthly. Employer duties under Nigerian health and safety law. 1. Provide and maintain a safe workplace, safe premises, safe equipment, safe systems of work. 2. Provide adequate training on health and safety. 3. Provide protective equipment, PPE gloves, safety goggles, helmets where required. 4. Risk assessment, identify hazards, assess risks, implement controls. 5. Maintain first aid facilities, first aid kits, train first aiders on site. 6. Provide fire safety measures, extinguishers, fire exits, alarms, fire drills. 7. Report accidents, reportable accidents recorded in an accident register, serious injuries reported to relevant authorities. 8. Contribute to NCIF Employee Compensation Fund. Employee duties for health and safety. 1. Cooperate with employer health and safety procedures. 2. Use safety equipment and PPE provided. 3. Report hazards, accidents, or near misses to supervisor immediately. 4. Do not interfere with or misuse safety equipment, fire extinguishers, safety barriers. 5. Follow safe working procedures, attend health and safety training. 6. Take care of their own health and safety and that of colleagues. Fire safety is particularly important in Nigerian offices. Fire extinguishers ensure appropriate type for risk. Class A, paper/wood. Class B, flammable liquids. Class C, electrical, CO2 for electrical fires. Fire exits, clearly marked, never blocked, lead to assembly point outside. Assembly point, designated area outside the building where everyone meets after evacuation. Fire drills, regular practice evacuations, every employee knows exit routes. Generators, major fire risk in Nigeria, placed outside or in dedicated generator rooms, proper ventilation, no fuel stored near generators. Do not overload power sockets, leave electrical equipment on overnight, block fire exits. Summary of health and safety in the office. OHS, identifying hazards, assessing risks, controlling risks, monitoring. Common office hazards, sleep/trips, fire, electrical, ergonomic, poor lighting, stress, harassment. Nigeria law, Factories Act, Labor Act, Employees Compensation Act 2010, NCIF. Employer duties, safe workplace, training, PPE, risk assessment, first aid, fire safety, NCIF contribution. Employee duties, cooperate, use PPE, report hazards, follow procedures. Fire safety, right extinguisher type, clear exits, assembly points, regular drills, generator safety.